A very good afternoon to one and all. Welcome to today's session on ovarian cyst. To speak on the topic today, we would like to welcome Dr. Rolika Keshri, our in-house consultant for obstetrics and gynecology. She has done her MBBS and MS. We welcome you, doctor. You can now take over the session.
Thank you, Chatura. Hi, everybody. I'm Dr. Rolika Keshri. I'm a gynecologist and obstetrician at Apollo Cradle, Kondapur, Hyderabad. So today I chose to discuss on the topic of ovarian cyst. It has been like in my practice, I have been seeing a lot of patients coming up with problems, and they are really stressed out with these kind of small cysts, big cysts. So I thought we should discuss a little bit about it. What is an ovarian cyst? So ovarian cyst is any cyst which it is like a sac which contains fluid, and any sac-like structure which contains fluid. Fluid could be any kind of material which is either within the tissue of the ovary or on the surface of the ovary. So these are called ovarian cyst. It is very common in the reproductive age group, and between the age of around 15 years to 45 years, we see these cysts even after 45 years. So I'll just tell you how we proceed. So in what are the symptoms of an ovarian cyst? Ovarian cyst, usually patients present with pain abdomen or irregular periods, or sometimes they have pressure symptoms. Sometimes they complain of pain during intercourse. Sometimes they have vague pain all around the lower abdomen, and sometimes there is no presentation, no symptoms. These patients come with a scan report which has been incidentally we detect an ovarian cyst during a scan, regular health checkup scan. So the symptoms, as I said, pain and pressure symptoms. So these symptoms usually most of the cyst which is in this age group, when we see all these cysts, most of these cysts resolve during a period of 1 month to 3 months. But certain cysts has to be taken care of, and we cannot ignore these cysts. So when we get a symptom like this, we ask for a basic scan. And suppose we get a cyst, we have to first find out what kind of the content of the cyst, what kind of content is there in the cyst. So it could be just a watery serous content or a mucinous kind of content, or it could be blood. It could be some other material which we call the cyst as teratoma or dermoid cyst, in which you can get fat, hair-like structure, hair and teeth, any other tissue which can be there inside the cyst, which is produced by the totipotent cells. And that is a very distinct kind of ultrasound report we get, and they mention is that dermoid cyst, which has to be taken care. Then there is a cyst called endometriotic cyst. I will discuss as I proceed. So we have to first see the size of the cyst, we have to see the content of the cyst, and what symptoms the patient complains of, and accordingly treat the patient. So when the patient comes with certain symptoms and we find a cyst which is less than 5 centimeter of size, and it is a plain serous cyst or a mucinous content cyst, means the fluid inside the cyst is basically clear. In that case, we don't usually immediately start treatment. We will ask the patient to do few blood investigations, and in case the size is close to 5 or around 5, we ask them to do a MRI scan to just find out which kind of cyst it is. Plus the tumor marker, which is CA-125, has to be done. Then suppose the cyst size is less than 5 centimeter, it has these small cysts, we usually treat them by giving, if the pain is there, we give them NSAIDs, painkillers, plus we try them with some oral contraceptive medications. Usually we give them for 3 months time, and in 3 months time we ask them to repeat the scan again to see the size, whether it is increasing in size or decreasing. And if the size is so most of the cyst, most like 60-70% of the cyst will automatically resolve during the course, but some cyst usually stay as it is, or sometimes it increases in size also. In those cases we need to take care of that cyst. Now, what are the investigation? As I said, we have to do a ultrasound, basic ultrasound. Sometimes we have to do a transvaginal ultrasound also to find out the exact size and the content of the cyst. Then, as we proceed treatment, as I said, we have to give oral contraceptive pills and observe them for 3 months and call them again for a follow-up checkup. Then what are the complications which can arise because of the ovarian cyst? So the complications usually we can list as infection, or sometimes torsion of the ovarian cyst, sometimes rupture of the ovarian cyst, and sometimes it may change into cancer also. So infection is like any cyst which is long standing and it is there in the body for a long time. It is always prone to infection. So patient may complain of fever. Patient may complain of severe pain during severe pain, and present in the emergency sometimes. So we have to find out whether the content of the cyst has become changed into pus. So in that case, emergency, we have to put her on antibiotics and plan to do surgery in that case. So infection is a very common complication of ovarian cyst. Then we may have torsion of the ovarian cyst. So torsion means it is a twisting of the ovarian cyst. Like suppose we hang a balloon with water inside, and suddenly when with a jerky movement, or suddenly a patient bends and gets up, or she lifts a heavy weight, this cyst can rotate on its own axis and cut off the blood supply to the cyst. So when the blood supply is cut off, the patient will complain of extreme pain, and sometimes even these cysts may start becoming gangrenous. Means the cyst may have complete loss of blood flow, and the cyst may start dying. The cells may start dying, and it causes extreme pain. It is also very dangerous for the health of the woman. So in those cases, we have to do an emergency surgery to either untwist the ovary or then the ovarian cyst, or sometimes even we'll have to take out the ovarian cyst. Then this is torsion. Sometimes it is rupture. Rupture means, suppose same thing as I said, if we keep filling the balloon with water or any liquid, and it keeps increasing in size, it at a point of time it may sometimes give way and it may rupture. So in that cases, heavy bleeding can happen, very severe bleeding may happen, and the content of the fluid which is spilled out into the abdomen may cause peritonitis and very severe pain, which is very, very risky for the health of the lady, the health of the woman. So in that case also, patient lands up in emergency, and we have to urgently treat this condition, because otherwise it may become fatal sometimes. Then sometimes it may become long-standing ovarian cyst which has been untreated, and sometimes it has become a very big size. These cysts may be prone to become cancerous also. So in those cases, we have to first diagnose how which kind of cancer is coming up, and whether the cancer has spread to it is still inside the cyst only, or it has spread to the walls, or it has spread to the other organs or the lymph nodes. So in those cases, we have to plan surgery accordingly, and post surgery we might have to do chemotherapy also. Sometimes big cysts may need chemotherapy before doing a surgery, and then after the surgery again chemotherapy may be needed. Prognosis for these cancers, ovarian cancers, depends on which stage we get to know the cancer, we get to know the diagnosis. So ovarian cyst has to be taken care, and we have follicular cyst also, corpus luteum cyst. These are small cyst which is very it happens during the normal reproductive cycle. These are small for during the follicular phase, means the first half of the cycle, these cysts form, but these are usually benign cysts, and they usually subside in the next period, or over a period of 2 to 3 months. These follicular cysts, these corpus luteum cysts will subside, so there is nothing to be worried about. I'm getting some questions. How big does a ovarian cyst have to be to get it removed? So usually we say that it should be a 5 centimeter or more to be planned to remove the cyst, but it does not depend only on the size. Sometimes, as I said, a dermoid cyst, for example, it has to be removed even if it is a 3 centimeter size, because the dermoid cyst have a chances of rotation, very high chances of rotating, because it's a very heavy cyst. So, even if it is 3 centimeter size and we detect it, we should remove this cyst. So it does not always depend on the size. It also depends on which kind of cyst it is. And usually cutoff is 5 centimeter. Above 5 centimeter, we should start thinking more of it, treat them medically. If it's not decreasing in size, or it's constantly the same as 5 centimeter, we should plan to remove the cyst laparoscopically. How many months does I'm getting some questions. How many months does ovarian cyst last? No, we can't say this. Like, this is a question in which you can't say how many months it lasts. It depends on what treatment you are giving, because once the cyst is diagnosed and the doctor feels that the cyst has to go, either we have to treat it medically or remove it surgically. We cannot just leave it like that for a long time, because it may change into cancer. So we have to take care of the cyst. A small size cyst, sometimes para-ovarian cyst. Para-ovarian cyst is a cyst which is just beside the ovary, near around the ovary, but not sticking to the ovary. These para-ovarian cysts usually are mostly benign. They don't change into cancer, and these can be left without any problem for a long time. But we have to keep the patient under follow-up always. How can the physician decide if an ovarian cyst is dangerous? So we have to see the level of CA-125, the consistency, as I said, if it is, which kind of cyst it is. If it is a clear cyst, usually we can leave the cyst for some time. If it is a heterogeneous cyst, means there is different kind of content inside, means it may be blood or mixed content, blood and serous, or loculated cyst. Loculated cyst is a cyst in which there are septas, there are walls in between, and there are locules locules inside the cyst. So which kind of cyst we have, the doctor will decide whether the MRI report, the CT scan report, whether these are coming proper or not. Then only we tell the patient whether it is dangerous or not dangerous. Then another question is, what if you are pregnant and your ultrasound shows that you have an ovarian cyst? Yes, it is a very common condition. We see usually when patient comes with a scan report of a pregnancy report, and she gets to see a ovarian cyst. So it depends now. So because during pregnancy, if a cyst is a small size cyst, we usually follow that up, but we don't do anything. No treatment is given. We'll just keep it under watch and explain to the patient that this size of the cyst can increase because the The reason for these cysts are usually hormonal imbalance. So in pregnancy the hormones become high, so these cysts can increase. So it is like a feeder to the cyst, so it can increase in size. But even if the cyst increases in size, unless there is a complication like torsion or rupture or some infection, only then we plan to operate during pregnancy. Otherwise we just leave it like that. If it's not disturbing the pregnancy, we do not do anything. After the delivery of the baby, we will plan a separate session, separate surgery for the removal of the cyst. So if it is a normal delivery, suppose if it is a cesarean, then during the cesarean only we can remove the cyst, depending on which kind of cyst it is. So uh, during pregnancy we have to take a call whether this is whether the cyst is increasing in size, whether any complications is there, then only we have to remove the cyst. So do ovarian cyst affect fertility? Yes, it may. So it depends on which kind of cyst it is. So we were discussing about the endometriotic cyst. Endometriotic cysts are related to fertility. We see a lot of infertility patients coming up with endometriotic cyst. Endometriosis is a situation. Now I'll explain a little bit of endometriosis. In endometriosis, what happens is normally the inner lining of the uterus sheds off during periods. So the inner lining is supposed to shed off with the hormonal withdrawal. Whatever the cycle happens in the 28-day cycle, when the hormone withdraws, this bleeding happens. This is the inner lining which is called endometrium. This sheds off each cycle. Now, this endometrium is supposed to be only in the uterus. It is not found anywhere else in the body. In endometriosis, there is a condition in which this endometrium gets implanted somehow outside the uterus or inside the walls of the uterus. So if these cells are implanted inside the myometrium, it is called adenomyosis. If this cell is implanted in the tubes of the in the fallopian tubes, it may cause hematosalpinx, means there could be blood collection in the tubes. If these cells land up into the ovaries, we get endometriotic cysts. They are also called chocolate cyst because they look like dark chocolate. The consistency is like dark chocolate because the blood color alters over a period of time and it doesn't seems to be red, it becomes a little chocolatey. So these are also called chocolate cyst. So, and endometriosis affects fertility because there are patches. What happens is these endometrial lining, when they get planted everywhere in the body, in the lower part of the abdomen, each cycle when the hormone withdraws, these points of endometrium, these cells which are external to the endometrium, also starts to bleed. So every cycle these bleeding happen, and with the bleeding there will be some scarring, either the collection of the blood or there will be some scarring and fibrosis. This causes adhesions inside the abdomen, which causes, like, adhesions are when the organs get stuck to each other, and hence the mobility of the tubes are affected. If there is an endometriotic cyst, means there's a chocolate cyst, sometimes the ovaries do not produce eggs properly. So in these cases it will affect fertility. Sometimes even for para-ovarian cyst needs to be removed when there is, like, a patient comes with infertility and the long standard para-ovarian cyst is there, and sometimes we need to remove the para-ovarian cyst also. So it may affect fertility sometimes. Is there any role of combined oral contraceptive pills? Yes, there is a definitive role in treating ovarian cyst. Oral contraceptive pills are used for treating pills because, as I said, ovarian cysts are because of hormonal imbalance. So when we give oral contraceptive pills, we try to regulate your cycles, and with the regulation of the cycles, these ovarian cysts disappear. Most of the time these ovarian cysts, small ovarian cysts, disappear. Then we have question as that was the. Okay, so we'll wait for some time for more questions if we have, and meanwhile I want to discuss something about a dermoid cyst. So dermoid cyst should not be left as such. Means if it is found, we should treat it as early as possible. If it is found during pregnancy, as I said, we don't usually touch because it can harm the pregnancy. When the surgery itself can harm the pregnancy, so unless it is causing any problem, we do not remove it during pregnancy. But otherwise, if a dermoid cyst is found, usually we try to remove it. But the only thing is, when a dermoid cyst is found, we have to be very careful because there can be another dermoid in the other side of the ovary. So follow-up scans as prescribed by the doctor should be done regularly so that we can catch a small dermoid cyst which is developing in the other side of the ovary. Then endometriotic cysts are very, sometimes cumbersome because endometriosis is a diagnosis which we do not understand with an ultrasound. Ultrasound will not give us the diagnosis of endometriosis. It is the symptoms of the patient, and which is like chronic pelvic pain. Patient will keep coming with either dysmenorrhea, means pain during periods, and chronic pelvic pain. And when we do a laparoscopy, when we put a laparoscope inside the camera inside the abdomen, then we see those small spots and the adhesions and the definite picture of endometriosis, and then only we can diagnose diagnose an endometriosis. Sometimes these endometriotic cysts are difficult to remove during the surgery because these cysts are all stuck together with the bowel, sometimes with the bladder, and sometimes with the uterus. So sometimes these cysts can cause problems during surgery. But most of the ovarian cyst, it may be it endometriotic cyst, dermoid cyst, or any other cyst, we can remove it with simple laparoscope only. Laparoscopy is a very good technique in which we just put put a camera inside the abdomen, and with 1 centimeter of a hole, and or maybe sometimes 5 mm of small holes we make, and we remove the whole cyst with those 3-4 ports only. So it's a better technique than opening up the whole abdomen and removing the cyst. So even big size cyst like 20 centimeter size cyst, sometimes 26 centimeter size cyst also can be removed by a laparoscopy. But we have to be very careful. We should not puncture the cyst, and the biopsy has to be done. With the biopsy, we get to know whether it is cancerous or it is a benign cyst. Any more questions, Chatura? Okay, so I don't think there is any more questions. I end this session with the hope that everybody is fine and safe during this COVID times. Thank you so much.